Welcome to Pharmacology Outline channel. Today, we're venturing into the fascinating world of the autonomic nervous system, or ANS. What is the autonomic nervous system? Autonomic nervous system is a subdivision of the peripheral nervous system and plays a critical role in regulating involuntary physiological functions like heart rate, blood pressure, digestion, and respiratory rate. It's divided into two complementary branches: sympathetic nervous system and parasympathetic nervous system. 1. The sympathetic nervous system. Often dubbed the fight or flight system, the sympathetic nervous system prepares the body for stressful or emergency situations. It increases heart rate, dilates the bronchi in the lungs for improved oxygen intake, and redirects blood flow to skeletal muscles by constricting blood vessels in less vital areas like the gastrointestinal tract. 2. The parasympathetic nervous system. In contrast, the parasympathetic nervous system is the rest and digest system. It dominates during periods of relaxation, slowing the heart rate, stimulating digestive processes, and promoting energy conservation. Let's compare between sympathetic nervous system and parasympathetic nervous system regarding one origin of fibers. Sympathetic nervous system originates from the thoracolumbar region of the spinal cord, specifically from the T1 to L2 levels, while parasympathetic nervous system originates from the craniosacral regions. Cranial part includes cranial nerves 3, oculomotor, 7, facial, 9, glossopharyngeal, and 10, vagus. Sacral part includes spinal segments S2 to S4. Second, location of ganglia, sympathetic nervous system. Ganglia are located near the spinal cord in the sympathetic chain or collateral ganglia. Ganglia are typically farther away from target organs. Instead, parasympathetic nervous system ganglia are located close to or embedded in the target organs. 3. Length of nerve fibers. Sympathetic nervous system. Preganglionic fibers are relatively short, while postganglionic fibers are long as they need to reach target organs, whereas the parasympathetic nervous system has the opposite arrangement. 4. Neurotransmitters. Sympathetic nervous system. Preganglionic neurons release acetylcholine, which acts on nicotinic receptors. Postganglionic neurons primarily release norepinephrine, which acts on adrenergic receptors, alpha and beta. Exception: sweat glands, where postganglionic neurons release acetylcholine instead of norepinephrine. In contrast, in parasympathetic nervous system, both preganglionic and postganglionic neurons release acetylcholine. Postganglionic acetylcholine acts on muscarinic receptors in target organs. Let's discuss the effect of sympathetic and parasympathetic systems on different organs. The sympathetic nervous system increases heart rate and contractility, while the parasympathetic system decreases them. In the lungs, the sympathetic system causes bronchodilation, whereas the parasympathetic system leads to bronchoconstriction. For the eyes, the sympathetic system induces pupil dilation, mydriasis, while the parasympathetic system causes pupil constriction, miosis. In the digestive system, the sympathetic system inhibits digestion and reduces motility, whereas the parasympathetic system stimulates digestion and enhances motility. Lastly, in the urinary bladder, the sympathetic system relaxes the detrusor muscle and contracts the internal sphincter, while the parasympathetic system contracts the detrusor muscle and relaxes the sphincter. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.